And then for my second report, I was rather keen on Legionnaire's disease, and we'd had an outbreak in the Army Computing Centre in Worthy Down in Hampshire, and it had closed down the Army Computing Centre for 2 days, which meant for 2 days the Army couldn't actually function. So I was keen to do that, but I was told, no, don't do that. We want you to go and look at a new anti-malaria drug that's just come in called Lariam, and just go and evaluate it. It's a really good drug. So I thought, okay, I wasn't interested in malaria then, but I thought, well, you do what you're told in the Army. So I set up, well, because I'd been trained in epidemiology, I knew the right way to do an evaluation of a drug or a service or a vaccine is to do a randomized controlled trial. So in 1993, I did a little pilot trial in soldiers going to Kenya who were taking this new drug, and that went well. Then in 1994, I set up a full-scale randomized controlled trial of this new drug. And the study population were the 1st Battalion of the Grenadier Guards, who were going to Kenya for 6 weeks. There's malaria in Kenya, so there are about 640 in the population. And so I should have said I got research ethics approval, obviously. And so they were randomized into 2 groups. The first group were randomly allocated to receive the new drug, which they would have got anyway, actually. And then the other group were randomly allocated to receive the old combination of drugs that they would have got the year before. So I did this trial, and this is relevant, I think, to what we're going to talk about later on. But it was a bit unsatisfactory because the soldiers going out to Kenya were given a questionnaire on week 2. That's at the point where they were flying to Kenya, and then again at week 8 when they were flying back. And I entrusted the questionnaire to the Royal Air Force, who were flying them from Price Norton. And I didn't get a very good response. I got about a 56% response for the first questionnaire and a 48% response rate for the second questionnaire. So that's not really very good in a randomized controlled trial. You want to aim for 100%. So and another thing that was odd about it was that a lot of the soldiers, one of the questions was, have you been taking the drugs correctly? And about 17% of them, even though they were responded, admitted they hadn't. So this raised concerns. But anyway, I wrote the study up, and it was published in the Transactions of the Royal Society of Tropical Medicine and Hygiene. I'd offered it to the British Medical Journal, and they said, well, Dr. Croft, Major Croft, this is interesting, but normally we expect a response rate of about 60%. When it falls below that, when the dropouts are so high, you can't really necessarily ascribe validity to your results to the degree we want it. So anyway, so I then did the following year. In the meantime, I'd passed my Part 2 exam, putting in my pregnant servicewomen paper and my malaria paper, but I thought I'll do another randomized controlled trial just to sort of get to the bottom of this problem. Why are soldiers throwing away their drugs? And this second trial took place in between October 95 and January 96, and the trial participants were the Princess of Wales's Royal Regiment, based in Dover. And on this occasion, I went down to Dover and I spoke to the second in command. I said, this is a very important trial. We need to know how good these drugs are, how well tolerated they are. So he put it on Part 1 orders, which are what soldiers read every day. You really must take your pills during this when we're in Kenya, and if you want to, if you don't like them for any reason, just tell the medics, and we'll sort it out. And then I personally went to Price Norton at 4 a.m. on a number of occasions, because they went out to Kenya in waves. I personally gave the questionnaires to the troops, and the idea was they had to fill out a questionnaire or they didn't get on the plane. So I got a 100% take-up rate, and it was the same coming back. They wanted to come back. So it was very good. But unfortunately, there was a point in the middle where somebody went out and they did the questionnaire in the middle. Towards the end of the trial, the whole thing collapsed because I was taken off the trial and sent to Bosnia. And also there'd been an unexpected event where a soldier had become psychotic taking Lariam. And later on, another soldier committed suicide from taking Lariam. So it was very unsatisfactory. Anyway, I was no longer in charge of the trial and went to Bosnia, came back, and then the following year I wrote a Cochrane systematic review of this particular drug to try and establish what were its proper properties based on randomized controlled trials, including mine, and that's how I got involved in Cochrane reviews.
With the University of Portsmouth, can you explain that a little?
Yes, I worked in the army as a public health physician for 27 years, and towards the end of my time, I started a doctorate course at Portsmouth University part-time, and this continued, and it went on quite a long time, 9 years, and during lockdown I was able to complete my thesis. That was part of the, for me, helpful aspect of lockdown, which was otherwise very damaging for me and for everyone. So I put in my thesis, and the title of my PhD thesis was Evaluating the Adverse Effects of Anti-Malaria Drugs, which I've been working on for nearly 25 years. But the PhD came in only towards the end of that time. So part of that thesis, with a PhD thesis, you're supposed to include as part of it 3 or 4 scientific papers that you've published, and they will be discussed in the exam. I had 12 papers that I included, and they covered a range of epidemiology, not just malaria. So I put in my written paper in 2020, and there was a hiatus because the universities were kind of not functioning. But in 2021, I was told I could now have an oral examination on the paper. So this took place in 2021 remotely. And for PhDs, you have 3 examiners who quiz you on your thesis. Normally there's one from the university and 2 external examiners. So I had 3 examiners. It was done remotely. And at the end of it, they can either reject your thesis or accept it, or suggest major changes or minor changes. But at the end, I said, no, you can be a PhD. They said you can be a PhD immediately, which was very nice. But do make a few minor changes like typos. And they said it would be helpful if you enlarged a bit on. There was a section where I talked about the need for further research, and said to just write a couple of extra pages for that. But for practical purposes, you can call yourself a PhD from. That was December 2021. And I actually wrote up the bits they asked me to do in January after Christmas and sent it in. Then I got the letter back saying that's fine, and picked up my PhD in person in July 2022. And by then, everything was open, so it was very nice.
You've mentioned now on a couple of occasions
Yes.
an interest in malaria, and we will come to look at some of your papers, but I think we can see in your published papers that you have had over a very considerable number of years an interest in malaria and its treatment. Is that right?
Correct.
Thank you.